In Better Health today, if you're not feeling well and you are worried something could be wrong with your heart, you want answers and fast.
Until now, most might just head to the hospital ER. But, Carrie, you recently visited the first walk-in cardiac care center in our area?
I did. Central Connecticut Cardiologists have now opened the Prompt Cardiac Care Center to give patients peace of mind without the wait.
Bernard Wilbur of West Hartford is 92 years old and walks at least a mile every day, sometimes two. But one day, he just didn't feel right.
I was beginning to be a little breathless at the end of my walk, and I belonged to an exercise group, and so I was able to check my heart rate, and my heart was beginning to race. So the combination of both of those concerned me, and I called my primary physician.
Wilbur's doctor sent him here to Central Connecticut Cardiologists in the West End of Hartford. This is their new Prompt Cardiac Care Center to help patients fast without the hassle of the hospital.
I was met by a nurse, and one of the things that pleased me was that my primary physician had already sent a lot of information so that I didn't have to fill out all those forms that you usually have to fill out. They knew all about me, probably knew more about me than I wanted them to know, but they knew it. And she immediately gave me an IV, and they started doing heart tests.
Dr. Scott Galley has been a cardiologist for close to 40 years and took care of Wilbur.
Going into the emergency room is a little bit of an ordeal. And the older you are, the more of an ordeal it can be. And so there's a lot of waiting. There's a lot of tests that are done, not knowing what's going on. You stay there for a very long time before you get a clear diagnosis. And then many of the things, you know, you can end up in the hospital for things that could be managed without putting him in the hospital.
Here, Dr. Galley says he has all he needs to test Wilbur's heart, including machines for stress tests, EKGs, and even a nuclear room that allows him to test blood flow in all the chambers of the heart.
The old nuclear cameras would take a room twice this size. But like everything else, you know, it gets smaller. So now we have just this recliner. We have a dual-headed camera which kind of revolves over the patient. We put the nuclear isotope in there. We can scan the heart. It takes 15 minutes to do that scan.
Wilbur got a quick and clear diagnosis.
He goes to see his doctor, and he's in a very rapid heart rate. His heart rate is 150, should be about 70. So he's in atrial fibrillation, which is probably one of the most common cardiac arrhythmias out there.
Under the old system, Wilbur would be sent to the hospital, maybe even by ambulance. He might wait hours to see a cardiologist and likely spend a night or two in the hospital. All that is scary and cost a lot of money.
And yet this is not a life-threatening arrhythmia. This is an arrhythmia that can be treated simply in an office environment if you have the right setup.
After a couple of hours, I was stabilized, and I went home.
For people watching at home, they're going to be like, oh my gosh, it's my heart though. I just want to make sure I'm doing the right thing. You feel confident that they're getting everything they need when they come here.
Well, the blood tests that we do are the same blood tests that the emergency room does. The monitor is the same. Our EKG equipment, that's all the same. So the key is the diagnosis. Now, once you get the diagnosis, you can say, well, this can be handled safely. We'll do it this way and let them go home.
When you arrive here at Central Connecticut Cardiologists, you'll come right here to the prompt care check-in window, and immediately a cardiac nurse will take you back. You'll be brought to the Prompt Cardiac Care Center, and you'll be seen by a cardiologist within 5 minutes.
He's placed on a monitor here so we can monitor him at this center and also in the front of the office, and they're kept on monitor at all times in here. They'll get blood tests, and then if they need imaging studies, they'll go to our upstairs facility where they'll have stress tests, ultrasound, nuclear tests, whatever's needed to make a determination whether they need hospitalization or they're safe to be discharged.
Dr. Russell Ciafone is one of the cardiologists that founded this center about a year ago. They've had 103 patients since then. Only 10 were sent to the hospital. The other 93 were given everything they needed for their hearts right here.
This is the recording. We're watching the patient live on the monitor so we can see if there's any arrhythmias. The nurse is here. We also have another set of monitors up front where the nurses can monitor, and if there's a change, then we let the doctor know.
This model of cardiac care exists in other cities like New York, but it's one of the first to open in our area.
I found them to be good, and I found the whole facility to be a good experience.
Yeah, and so much easier, right?
Oh, my gracious. It's not confusing. It's not, you know, you feel as though you're important.
That's That's because the patient gets one-on-one immediate care by specialists trained in various areas of cardiac care.
What's special about, tell me a little bit about what you said.
So we have different colleagues in my office have training in particular areas of cardiology. Some of us, as I like to say, are the plumbers of the heart and put in stents, and some of us are the electricians of the heart and do devices like pacemakers and defibrillators and ablations of the heart. So we're able to really provide full service here.
Dr. Patrick O'Byrne is an electrophysiologist who tries to make things simple and easy for his patients to understand using technology like this to explain what's happening to their heart.
So we have sort of multiple tools at our disposal to educate our patients, on site while we're evaluating them in the office. And it allows them to help in decision making as well.
As for Bernard Wilbur, he's made up his mind about the Prompt Cardiac Care Center.
I think this is a wonderful alternative.
The Central Connecticut cardiologists like to say they're only a heartbeat away. And again, the new Prompt Cardiac Care Center is located right in the west end of Hartford off Woodland Street, which is just a moment away from St. Francis Hospital.
I know exactly where it is. I've seen it. All right, you can visit the center online at ctcardiology.com. Walk-in hours right now are just Monday through Friday during the day, but they may expand that as the need for prompt care grows.
And coming up tomorrow on Better.